Good morning, this is Doug.
And I'm Cindy.
Welcome to Help Me Help Mama 5cast. We're answering your questions today, and one great caregiver question we got is, what are some options for caring for an elderly parent? Well, there's a bunch of them. Today we're going to be talking about a few home options, caring for an elderly parent at home, and also a few facility options.
Okay, so we're going to start at home. Once you do an assessment and you determine that your loved one needs a little bit of care, assistance, or supervision, then you look at what the options are. So at home, we've got home with a well spouse, if they're married and their spouse is physically able to help take care of them.
And that'd be the obvious place to start, because mom and dad may have been married for 50 years and they're still living at home together.
Right. And they're kind of leaning on each other. One can do the physical things and the other's got the cognitive ability to still manage some things. Okay, so home with a well spouse or home alone. You know, mom or dad may be a widow or a widower. So if they're still able to be at home with a little bit of care or some supervision, then home alone may be a good option.
Yeah, and a lot of times mom can be at home. I know my mom was home alone. Your mom was home alone for a long time by themselves before they started to need extra help. Yeah. As you go down the continuum it may be home with care coming in. It may be with family caregivers, or it may be non-medical caregivers who you pay money. In our area, it's like maybe $20 an hour, $18 to $20 an hour to come in and help. And you can get them however many hours a day you need, maybe a few hours a day or maybe several.
Okay, another option would be adult daycare.
Adult daycare, yeah, which is kind of a hybrid situation. Like you did with your kids. You drop them off on the way to work, pick them up on the way home. And the advantage of that is you can continue to work, while they're being cared for during the day. It's good for some folks, not so much for others. And speaking of kids, what about the kids? They can factor into this. So
absolutely. So parents can move in with their adult children, or often we see adult children move in with the parent that is aging and needs some assistance. A child or a grandchild may move in with them. Right.
And by the way, we're going to be doing a more in-depth video on each one of these options, because each one of them we could talk on for like 20 minutes at least. But we're just kind of listing them today. These are the different options. So the home option again was maybe home with spouse, home alone, home with the kids, either mom with the kids or the kids with mom, or we mentioned adult daycare. So let's talk about facility options.
Okay, we also mentioned kids coming in to help a few hours a day, or a contractor. Like
a non-medical home
care provider.
Right.
Okay, so next option might be independent living. If your loved one doesn't mind moving out of their home, they could move into a community, and this is where they can still do pretty much everything by themselves and for themselves in independent living, but they have more socialization, which is important, right?
Right. And a lot of times the home is just not a good fit anymore. It's maybe too big. Mom's bedroom may be upstairs. There may be a lot of issues with it, a lot of deferred maintenance, big yard to mow, and she just needs to be somewhere else where it's easier, and she's got other people to socialize with. A lot of people like that.
If she needs a little bit more care or assistance or supervision, then assisted living, where she might need some help with activities of daily living. And this is still pretty independent. You have a community, but you've got somebody maybe managing medications and helping with a few other things.
And then, of course, the final level that we'll talk about is skilled care nursing home. And this is if you need 24/7 professional nursing care and maybe therapists, just help doing several activities of daily living. That's what a nursing home is for, to provide this level of care.
And I wanted to mention that there are private assisted living facilities and private skilled care homes. So you have a lot of options. I mean, all the way from being home alone to being in a big community and needing 24 hours, skilled care. So a lot of options.
A lot of options, and the key is to become familiar with all of these. I guess if there is a mistake, the mistake we see people making sometimes is this going from 1 to 8, thinking, okay, mom needs care, boom, assisted living. and not maybe considering some of these other options that we talked about. And a lot of these other options can be made to work for a long time. Your mom stayed at home, never went to nursing.
Never went to nursing home.
Some people don't have that option. Some people, my mom had a stroke, had to go to nursing home. So some people's health fails and they have to go to a nursing home, have to have more intensive medical care. And so that's the option. So we hope this information was beneficial to you today. Thanks for joining in today.
And thank you for being a caregiver for your loved one. You're making a huge difference in their life.
This channel and click on that little notification bell to be notified the next time we do a video.
And if you want to interact with us, check out the description below and leave us a comment and let us know what legal or caregiver topics you'd like to hear about.